Hello, everyone. This is Mr. Simone here, and I'm going to give you a brief overview of healthcare and health insurance reform efforts in the United States in preparation for a couple of days' activities that we're going to do with Miss Hayden in English class. So, before we get started, how can somebody pay for healthcare in the United States? And if I'm missing one here, please share it with me through an email. But there are four ways I think you can have your healthcare paid for. The first obvious way is you just pay for it out of your own pocket. If you'd like to take take out money and just pay for the expenses. But as you're probably going to find out pretty soon, it is incredibly costly. So another way you can have your healthcare paid for is through a government program. There are two programs called Medicare and Medicaid, which I will get to later in this slideshow. And people who are in the military, veterans, they have something called TRICARE. So we do have some government programs for health insurance. Now, the third way that most people get their health insurance through is you'll have a plan through your employment. So your job, one of the perks will be that you will have health insurance. And then the fourth way is if you're your own employer, or if you don't have it through work, you'll have to go out on the private marketplace and you have to purchase a private health insurance plan. So that just gives you hopefully a little overview on how you can have your health care paid for. Now I'm going to do very quickly just the history of healthcare through the United States. And I should point out, other countries, some countries in Europe, Canada, they have an entire program run by the government. So the health insurance industry is secondary. They just have government sponsored. And some people in the United States think that that's good, and some people in the United States do not think it's good. That's what we hope we're going to get into in our discussions and activities in class. So I'm going to go all the way back to 1912. I told you I'm going to do this very quickly. Teddy Roosevelt, when he was running for president, not when he was a Republican, but if you watch my earlier video, when he ran as a Bull Moose Party or progressive candidate, he was, to the best of my knowledge, the first president that actually called for just a universal health insurance plan throughout the country. But as you'll probably know by now, we never got that implemented. Then in 1929, just to give you an example of how people were thinking about health insurance, there was a program through Baylor University in Dallas, Texas, where teachers paid 50 cents a month, and that provided them with 21 days of paid coverage if they needed to go into the hospital. Then during the Great Depression, FDR, he did think about making a New Deal program that would have been for health insurance throughout the country. But instead, he put all of his efforts into a Social Security plan for people when they retire. Then you have Harry Truman in 1945. He's another one who called for a national health insurance plan, but his was going to be a voluntary plan. In other words, if you wanted to take part in a government-sponsored program, you could pay for it. And we don't have that. Today, there are some people that are calling for it. They refer to it as the public option. I would say the most significant health insurance reforms that have been done throughout the United States would be under Lyndon B. Johnson. We have something called Medicare and something called Medicaid. Medicare is for people who are elderly. So once you reach a certain age, you qualify, I believe it's 62, you qualify, it could be 65, I should probably look that up. You qualify for government program through Medicare. Medicaid is those people who have a limited income. Both of these are government programs. So everybody else in the middle are the ones that have to figure out, can I get it through my job? Can I pay for it on my own? Or can I just pay out of pocket? Now, more recently, Richard Nixon, he did pass what was called the Health Maintenance Act. So this is when we started to see larger medical insurance companies emerge in the United States. Then Ronald Reagan came up with something called COBRA. So something you'll learn as you get older is that a lot of people don't want to leave their job because they don't want to give up their health insurance. Ronald Reagan passed this act COBRA, which now says if you do lose your job or leave for whatever reason, you can keep that insurance plan. You still have to pay the premiums, but at least you know you have it for 18 months while you're looking for another job. Then Bill Clinton, he put his wife in charge of health insurance, and it did not go well. But the one significant achievement that they did make is a children's health insurance plan, CHIP, Children's Health Insurance Program, and the S is for states. So now various states have programs where all children are covered with health care. So that gets us to Barack Obama. And the Affordable Care Act is what I would like to spend our time on in class and look at the different components of it. What do we like? What do we not like? Why is it so controversial? And Ms. Hayden will talk about the language and the rhetoric of the debates here. But I hope this gives you a good overview. Again, I'm not going to take the time in the video now to go over the Affordable Care Act because that we're going to do face to face in class. But if this gives you a good overview of how health insurance operates and how we've evolved over the years, then I think you'll be more than prepared for the discussion in class. And again, for English, really focus on that first slide that I went over in terms of how somebody could pay for healthcare. So hopefully I kept it under 5 minutes. I probably didn't, but everybody have a nice day, and I will see you in class.